I'm Dr. Shafali Saini. I am working as the consultant dermatologist and trichologist at Traya. And today we are all here to discuss about one of the most commonly asked questions even in my clinical practice, and that's about the shampoos we ought to use for our particular hair types. So let's begin with that. So before we talk about anything else, what exactly is a shampoo? So anything that we use to clean our scalp and our hair is called a shampoo. Now what we need to understand is, usually we use a soap for bathing. So the constituents of a shampoo are slightly different compared to the soap we use on the body. And I will be coming to that. What really constitutes a shampoo, how it really helps to clean your hair, what is the correct shampoo for you, and so many fads in the market. So before we begin, we keep talking about wanting healthy hair. So what exactly is healthy hair? Any hair that you see that bounces when you move your head, is anti-frizz, is not easily breakable, is called healthy hair. It has to be lusterful. If it's dull and dead and sticky, then that's a problem. So now, when we talk about shampoos, shampoos are made up of various ingredients, and each ingredient has a particular function to fulfill. The most common ingredient and the most important ingredient in the shampoo is called a surfactant, and it is this surfactant which helps give the shampoo or impart its cleansing ability. Okay. So apart from these surfactants or cleansers, all of these newer shampoos that we see in the market these days have an inbuilt conditioner. So often with these 2-in-1 kind of shampoos, you don't have to use an external conditioner, but with most of the other lot, yes, a subsequent conditioner usage will be required. So apart from surfactants and conditioners, a shampoo will have a lot of additives for fragrance, additives to provide smoothness, and a very important category of shampoos is going to be medicated or therapeutic shampoos, which will actually, in addition to cosmetic products, also involve integration of certain medications. And I will come to that as to what is this category of people who will require therapeutic or medicated shampoos. Okay, so often I am asked, can shampoos really stop hair fall? Let's come to this. I think this is the most commonly asked question of all. So let's address it. Now, as you may know or may not know, most of the cases of hair fall happen because of a condition called as androgenetic alopecia. So androgenetic, it has it in the word that this is genetic hair loss. Okay. Or there are women or even men who come complaining of chronic hair loss, and they don't know the reason. They can't really pinpointedly say anything, but they are constantly losing hair. This condition is often called as Telogen Effluvium. तो ये जो दो conditions हैं हमारे, एक हमने बात किया एंड्रोजेनेटिक एलोपेशिया का और टेलोजन एफ्लूवियम का, ये सिर्फ एक्सटर्नल फैक्टर्स पे डिपेंड नहीं करता है. It depends a lot on your internal health as well. It depends a lot on what your hormonal status is. So naturally, if it depends on so many things acting internally, I don't think a shampoo which is used barely for 5 to 10 minutes is going to alter much on your scalp to prevent the hair fall. What one needs to understand is, hair fall control करने के लिए बहुत domains का interference with the client is essential. Your sleep needs to be proper. Your diet needs to be a balanced, healthy diet. You need to be in perfect hormonal status. No imbalances. कुछ hormones का ऊपर नीचे नहीं होना चाहिए. And apart from that, your scalp and hair need to be healthy. It has to be disease free. So when we talk of this, ज़्यादातर जो shampoos even market में हैं which claim there is 100% hair fall control, I would like to break the bubble. This is a fad. Shampoos can't really help prevent hair fall. What they help is with the basic functions that any shampoo intends to do, that is clean your hair and clean your scalp. If you really are looking forward to control your hair fall, you have to go in for a multi-modality treatment. You have to take care of your sleep, your health. Now, a lot of compounds are coming out in the market by the name of minoxidil, by the name of this new molecule called redensyl. These are precisely the molecules that help control your hair fall. So be assured, none of these shampoos that you waste your money on are going to help you control your hair fall. Alright. Now, another more important question that we are often asked is how many times or which shampoo should be good for me? So now addressing these two questions, which shampoo is good for you? So before we decide on which shampoo, we need to start getting a fair bit of an idea as to the kind of scalp you have, the kind of hair properties you have. And this is going to change person to person, okay? A person may have absolutely dry scalp, it's itchy, it's always irritated, the hair is dry no matter what you do. On the other hand, there may be people like me living in Bombay and their scalp and their face is oily and your hair just gets sticky in no time. And there are people who are like between these two extremes and their hair are neutral and so-called normal hair. So coming to the first category of people who have excessively dry and brittle hair, ये category के लिए you need a shampoo which is definitely mild on the cleansing, but it has very good conditioning value. तो आपके बालों को क्लीन तो कर ही रहा है, बट वो बालों को कंडीशन एक्सेसिवली कर रहा है. द कंडीशनर प्रॉपर्टी ऑफ योर शैम्पू इज हाई. Whereas those who have normal hair can just go around with a normal or an everyday kind of shampoo which has a balance of conditioner and cleaning property. For those who are blessed with oily, greasy hair like mine, so guys, we need a shampoo which is high on the cleaning factor because we need to get rid of the excessive sebum and dirt that our scalp tends to accumulate through our day of work. So now, often as a layman, you pick up products, with dry hair or greasy hair. So I would recommend that once in a while, you can have a check with your dermat, and your dermat can actually read up on the ingredients in the product and help you out with whatever shampoo suits you best. Okay. So another fad that we have been receiving questions on lately is how effective are the so-called new onion shampoos. So let's get to that. Now, of course, there have been studies on the use of concentrated onion juice for a scalp condition called as alopecia areata. So this is a disease of the scalp and hair where the person tends to lose hair in patches, in small circular patches. It may be on your scalp, it may be on the rest of your body. This kind of hair loss is very different from the androgenetic alopecia and the telogen effluvium that I spoke about. This category of conditions is known as an autoimmune condition. So the body is reacting against itself and causing the disease. Now, of course, the studies show, yes, we have received results, using onion oil or onion extracts for alopecia areata. But if you look at a shampoo and the constituents of a shampoo, the concentrations in which active ingredients use होते हैं एक shampoo में, तो ये बहुत डिफिकल्ट है कि आपके 5 या 10 मिनट के कॉन्टैक्ट टाइम में जितना देर आप शैम्पू अपने स्कैल्प पे यूज करते हैं एंड जिस कॉन्सेंट्रेशन में एक शैम्पू में हम इंग्रेडिएंट्स डाल सकते हैं, कि उस कॉन्टैक्ट टाइम और कॉन्सेंट्रेशन के जरिए हम एक्चुअली अनियन के कुछ बेनिफिट्स स्कैल्प पे पा सकें। तो मेरे नजरिए में आई फील दैट ऑल ऑफ दीज फैड्स अराउंड दीज न्यू all these onion extract infused shampoos and all cannot deliver what the shampoo promises. It's very difficult practically with how you use the shampoo really. Now there are people who also ask us, okay, could you tell us how frequently do we use a shampoo? What is good for my hair? Is daily shampooing damaging to the hair? So this question I would like to answer by firstly saying there is no standard cutoff. There is no cutoff, proven in literature कि आपको बाल इतने ही दिन धोने हैं, ऐसे ही टाइम पर बाल धोने हैं. But what we know is that for each and every person, the frequency of hair washing may depend on the type of hair or the type of scalp the person has, the gender of the person, the daily day-to-day activities that the person undertakes, the kind of climate that we live in. Now, of course, people living in Bombay know the pain of living in Bombay and you know what Bombay air does to your hair. So, yeah. So, like I said, there are a lot of factors which are going to dictate that. So for people who have very dry, excessively dry hair, I would recommend to not use a shampoo very, very frequently. Maybe say twice or thrice in a week should be sufficient. And you have to bear in mind, especially for people with dry hair, that it has to be supplemented with a good quality conditioner. It has to be maybe an instant conditioner, maybe a deep nourishing conditioners. We get various varieties out there depending on their ingredients and you know what ingredient can do what amount of conditioning effect. So एक conditioner use करना तो बहुत ज़रूरी हो ही जाता है. For people with extremely oily hair, on the other extent, sometimes there are people who may require washing their hair regularly. Because what happens is, if you avoid washing your hair regularly, you're predisposing your scalp to more infections. There are more chances of developing bacterial infections, more fungal infections. Just generally, you know, your hair loses its health. It becomes dry, lusterless, it becomes brittle. So for these category of people, you can use a shampoo maybe every day, every alternate day. But then again, a good quality conditioner is just something which is absolutely necessary again. And for those who are like in the middle of those two extremes, can just pick up their frequency whenever, you know, they do feel they need to wash their hair. It's been like a day or two, maybe, you know, twice a week. That works. Another important aspect of using a shampoo, which I would like to bring up because this is all over the internet, it's all across the world, is how to avoid using products with sulfate. Now, these two things are out there across the world. Now we have products with big labels, bigger than the name of the product, that yes, we are sulfate free, yes, we are paraben free. Why is it important to avoid these two constituents? Now, when you come to sulfates, like I told you, are a category of surfactants which are used to clean your scalp. But the cleansing action of sulfates is so high that it practically devoids your scalp of any kind of nutrition. Coming to parabens. Now, parabens are known to cause intense amount of local irritation. For some patients, it may be restricted to your hair, to your scalp. For a lot of patients, this irritation can even go down to affect your face. It can affect your neck. It can affect the rest of your body. This is a condition known as contact dermatitis. Okay, another question over the top of my head that is asked way too often is how good is using salicylic acid in day-to-day daily shampoos? So for this, I would like to tell you all that Salicylic acid is a drying agent and it is also called as a keratolytic. A keratolytic is something which breaks the skin. Now, having said that, salicylic acid is not required by all people. Now, shampoos which incorporate salicylic acid are the ones which are called as medicated or therapeutic shampoos. Who are the people who need it? People say with severe dandruff, not responding to your general shampoos, not responding to general medical care, they may require salicylic acid. People with a condition called as scalp psoriasis, I'm sure most of you would have heard of the condition. So psoriasis is again an autoimmune condition that the body is reacting against itself, and it can affect the whole of your body. It can affect your scalp, it can affect your eyelids. And again, this is the category of people where salicylic acid may help them. And of course, there are other conditions called as eczemas, which you may have heard, chronic eczemas over the scalp, not responding to anything else. Salicylic acid, pretty good option. But again, the downside is people with dry to normal hair using too much salicylic acid, that's a no. That's just going to, cause more dryness. It's going to cause your hair to become brittle. So yeah, choose your product carefully. Coming to a lot of questions on what exactly is ketoconazole. How does ketoconazole really help us? Most of us suffer from dandruff, of course, which may be mild, it may be moderate in some, and it may be very severe in some. Now, ketoconazole is the medication of choice to treat your scalp dandruff, because dandruff in a lot of patients is caused by a certain fungus which is found on our scalps. And in some people that gets activated, causes scalp irritation, and then causes dandruff. So ketoconazole is an antifungal medication, and that helps by eradicating the fungus on your scalp and helps you treat your dandruff. So this becomes, so you have so many, products which are over the counter. Some may be available on the prescription of a drug by the dermatologist. But ketoconazole shampoos, yes, this is something we go to for treating scalp dandruff. So we have a question, how often do we use a conditioner after shampoo? So I would suggest, yes, a conditioner is a must after using shampoo. I mean, to make your hair anti-static, anti-brittle, a conditioner is a must. Can shampoos treat gray hair? Okay, now this is something, yes, I would like to come to this. Now, gray hair, which happen especially in a younger age group, is called as kenites, okay, or premature graying. Now, so far, there has been absolutely no treatment possible for premature graying of your hair. Now, premature graying happens because of a problem at the level of your stem cells. Stem cells आपके बुढ़े हो गए हैं. आप नेचुरली पिगमेंट लूज कर रहे हो. जो आप 10 साल बाद करने वाले थे वो आप अभी कर रहे हो. तो दैट इज अ नॉर्मल अकरेंस. किसी केसेस में ये जेनेटिक होता है. किसी बच्चे के या पर्सन के पेरेंट्स में प्रीमेच्योर ग्रेइंग है, उनके ग्रैंड पेरेंट्स में प्रीमेच्योर ग्रेइंग ऑफ हेयर है. नो अमाउंट ऑफ शैम्पूज दैट यू यूज, दे मे क्लेम दैट वी कैन ट्रीट ग्रे हेयर and the likes and the sorts, but that does not happen. No shampoo can do that for you. What is the role of biotin for hair growth? Okay, now biotin is a very important vitamin for our body. It takes care of a lot of functions in our body, and it certainly is one of the most important vitamins for scalp health and hair growth. That is why nowadays there are a lot of topical preparations in the form of hair serums, in the form of shampoos that are fortified with biotin. Once you fortify with biotin, it's helping your scalp hair strengthen up. It's going to strengthen your scalp hair, and along with that, it's going to improve the blood circulation overall on your scalp. So the more the blood flows on your scalp, the more nutrients reach your scalp, and the thicker and stronger your hair roots become. What are the natural substitutes that we can use for shampoos? Okay, so now this is something which is picking up a lot of flavor in India as it is in the West. अभी काफी ऐसे लोग हैं who want to switch to organic substitutes to chemicals. तो आजकल we have a lot of top brands which are incorporating as many natural elements as they can in a shampoo preparation to make the shampoo less damaging, that long term use के बाद भी उसका scalp पे कोई बुरा effect नहीं होना चाहिए. So a lot of these substances, if you find shampoos with a bergamot oil or coconut oil derivatives, or maybe tea tree oil, shea butter, or you have a lot of natural pH balancers, if you have a lot of citrates and potassium sorbate, ऐसे अगर products आपके shampoo पे लिखा है, then you can be rest assured that yes, this shampoo is more in tune with incorporation of natural ingredients, and definitely this is a go ahead, a better product to use. Okay, so that's a wrap up on shampoos from me. And if there's anything you wish to know more, you can just shout out and reach out to us on our website, that is on Traya, and we'll be happy to help you. And I hope henceforth you pick the best shampoo and you have the best hair that you always dream of. So that's a bye from me, and I hope you all have a great hair day. Thank you.